are going to do some neck, scalp, a little bit of upper back work for Corrina here. Her hair is down, which is usually what I prefer for this work. I can move their hair around. In this case, I'm engaging a gentle twist through the hair, through all of it. This tends to pull through the fibers of the scalp. I'm going to engage a hand grip and gently slide. Usually when I do this, the receiver is going to maintain some neck tension because as I'm pulling, she's resisting. I'm going to slowly place my hand on her shoulder and embrace with the forearm so that as I pull, she can lean back into my forearm, making multiple points of contact through the hair, through the neck. Then I'll reverse sides on the hand, through the forearm, down through there. Using that forearm, just like we did, I can come in, put a little pressure. I'm using a broad, round portion of my forearm. I'm going to lean in and then gently engaging at her forehead. I'm going to guide my forearm gently into her neck. This is in the posterior. I'm guiding her in. She had a little bit of a sigh there. A little bit of pressure. Engaging movement. Since muscles cause movement, we use movement to access those muscles. I'm going to switch sides. Again, this posterior portion, I guide my forearm in. I'm able to embrace right around the forehead here, feels comfortable, and guide her into my arm. This is an easy way. It's less strain on me as a giver. If you are at a party and want to do this to someone, they are going to thank you and likely follow you home. Right in there. If I have the hair back, you'll see that it was draped over my arm. I'm going to guide her head gently forward so I can use my fingers to work through the back of the neck here. Got her hair up top, freeze up the neck so I can press. It feels like there's a little more tension on this right side, so I'm going to use my thumb pad, and just like before, I'm guiding her into my thumb. If I don't like grabbing the hair, I can grab at the forehead. I'm still at the posterior, the back of the neck. If it's ever too much pressure, she can let me know. Usually I can judge by facial expression, but occasionally you can ask for verbal feedback right near the base of the skull, right there. You can feel the tension. The tissue is dense. It's more firm than it was lower. Just bringing her body's focus there, her nervous system, so she can breathe. My thumb and its nail is facing up, and as I'm leaning her back, I feel like she might be catching the tip, so I'm going to turn the thumb to the side, right in there. The positioning and angle seemed like it was better, and I think that right there. One side, the muscle moved. The muscle gently slid over my finger, and I disengaged. We'll try to the other side, the opposite hand, opposite thumb. Different on this side, but again, she's right-handed, right dominant, means she might have a little bit more tension right into the suboccipitals on that side of the skull. And there's a little here, but not as bad as the opposite side. You're always free to change hand position in a way that works. I'm going to guide her head gently forward, pulling her hair to one side. I have an interlaced finger grip where I can press the palms, the heels of the palms together on either side of her neck. I'm avoiding the hair by scooping it up and above, and I'm pressing the palms, the heels of the palm on either side into the neck. Going slow. Big, broad heel of hand pressure. As you work, you'll notice that your hands may get tired. Feel free to switch it up. Any of the pieces that I've shown you, you can repeat. You'll learn to change vector, angle, hand pressure so that you're minimizing strain on your own body. Guiding. Once I have a good grip, there's a gentle lengthening to one side, lengthening to the other. And then if I've got a grip on both, I'm gently rolling her head down. It's lengthening both sides of the neck. I let her rest. And with both hands again, now the thumb pads, either side of the neck, right into, I believe, what's a portion of Levator scapula. We might also be catching splenius cervicis and splenius capitis. Big fancy names for neck muscles, that's all. Lots of small muscles here. We had a good spot. She gave me a little sigh there. Guiding in, then I'm gliding. I'm leaning over this way, then leaning over to the right, back and forth several times, seeing if I can engage a little bit of head and neck movement. And moved a bit higher, right into there. Now, we've had her head forward. I'm going to slowly have her lift her head. She's coming up and back. I'm pulling the hair, again, out of the way. And this time, I'm leaning far enough forward so I can let her head fall back onto my chest. This allows me to slide over the forehead. It gives her neck muscles some rest because we had her forward. I'm gliding over the face, around the temples, down around the jaw. Can get into the ears if I'd like. I'm going to move my chest just to encourage her to let her neck go while I do that. Receivers typically want to hold at first because they're used to using their neck to support themselves. Long term, you'll find that your sessions, the work that you do on people, will improve when you make them feel like a baby in their mother's arms. Completely safe, rested, relaxed, lots of body contact. They feel safe and secure. They release more that way. Right around the ears, down to the earlobes. And bringing her head back to neutral. I'm going to cup this hand around the base of the skull, this around the forehead, and anything that attaches in here, as long as I'm to the side of the neck, not the front, around the base of the skull, I can move the fingers in and out around the base, finding tension again through the base of the skull. Right in the back on that right side, this finger right in there, still tender. Oh, I'm going across the fibers, back and forth, side to side, right into there where she's got a little tension. I'm able to support at her forehead, working through there, gliding along. Back and forth. Range of motion. What's restricted? What needs work? This is a little bit of a stretch as she's guiding, or gliding, I should say, to the side. If her head is facing forward and her head goes straight over, this is a little bit more of a stretch to scalenus medius, a muscle on the side of her neck. Stretch one side, Then I gently stretch the other, a little bit tighter on this side. I think the range, there we go. I'll come to the opposite side, opposite hand, again, right at the base of the skull. My thumb is a little bit stronger, so it allows me to get that spot of tension right at the base of her skull. My thumb is pressing right on this right side into there. I'm turning my thumb, that same position we had previously with my thumbnail facing out towards myself, hooking right at the base of the skull, engaging some movement. And I'm going to reach the hands straight up into the scalp, around the hair. I can support at the base of the skull. I'm shampooing the back of the scalp, around the parietal bones, around the occiput. Sounds fancy, sounds complex, real basic anatomy, just landmarks for you body workers out there. Shampooing the scalp with the left hand. I can engage again that little bit of head movement because we're encouraging her to let go. I try as much as possible in session to use movement to help the receiver let go, provide a sense of safety and security. I've shampooed the back of the head, so I'm going to pull the hair back again. I'm going to have her rest her head into my chest and right around the ears. This position feels a little off, so I'm going to change the hands up and around top of the skull. Once I have her positioned, I can let her rest back again. Then around the temples. Temporalis, this large muscle over the temples, over the temporal bones, goes down under the cheekbone into the jaw. It tenses when people chew or don't speak their truth. So we go in, work on this guy sort of with the fibers in this direction, up, back, and over, and then cross fiber. Right in the scalp. Holding on to her hair, we can again return to that very gentle hair pull and twist. If we did one side, we can reverse it to the opposite. I'm twisting and pulling. I can always get some support there with the forearm. She's getting into this more. She's letting go. She has more parameters for what I'm doing. I'm gonna switch sides, moving her around. Long term, you're teaching the receiver that it's good to let go. It's good to release, to relax. You're providing a sense of calm. In the upper back, I can use the thumbs, the thumb pads, to press on either side, the typical pattern you see for somebody pressing into someone's upper back. As I get into this junction between the upper back and neck, this feels tender and tense. And instead of using my fingers, I'm going to use my forearm. I'm going to guide her head forward and over. I'm going to lean in with the forearm right there. I'm going to reinforce with the other. Makes it easy for me, very effective for her. I can feel her breathe and let go on each exhale. I'm holding this pin. Now I'm going to stretch Levator scapula and trapezius down and forward. Can mobilize slightly and back to the stretch. Holding here, I can gently put my arm under hers. Can allow her rotator cuff to open, give me some traction and lengthen there. This sort of pulls her into my forearm where I'm putting pressure. always innovating, trying to find ways to work smart. I'm going to switch the hair to the opposite side, just so it's out of our way. This junction here, again, with the forearm. Going to lean in. A little bit of pressure, a little closer to the neck. Reinforce, make it easy on myself. And again, I can feel her gently breathe and release. Good compression there to levator scapula, the top of the upper back. I've got the pin. We're going to stretch. All within the range of motion that she's got. If you work on someone and their neck is more limited, just go to where their edge is comfortably. Intense is okay. Pain is not. Back to center. Both hands in the upper back. And scalp again. Move the hand and fingers around. You're shampooing the scalp. You can come out to the side. The hair goes in the face from this direction. No bother at all. You can switch sides. Working on the scalp. And to finish, I'll have the hair back again. I'm going to lean their head back. And just like before, a little split across the forehead. And contact. Thank you. Thank you so much for watching. I'm Robert Gardner of robertgardnerwellness.com. Feel free to go to the website and download your free Thai massage workbook. Thank you for joining us today.